Hello viewers, this is Dr. Madhushri Datta and today I am going to discuss a few injury medicines in homeopathy. Since there are many injury medicines in homeopathy which we can prescribe, so for effective comparative study, I have divided into several groups. Okay, so in this video, we are going to see or compare those remedies which are mentioned in Term 1, first BHMS syllabus. So here we are going to discuss about the injury medicines of first BHMS syllabus Term 1. So before we begin with, I would like to say that this video is intended solely for educational and study purposes. This is not a substitute for professional medical advice, diagnosis or treatment. Viewers are advised not to self-medicate or attempt any treatments based on the content presented here. Always consult a qualified healthcare professional before making decisions about your health or medication. Okay, so today we are going to discuss this following medicines like arnica, calendula, ruta, symphytum, hypericum, ledum, rustox and silicea. So these are basically the medicines which are given in the first BHMS syllabus. So beginning with the introduction part. Injuries are frequently seen in clinical practice. So you will encounter all sorts of injuries like your trauma, wound, fracture, sprain, even nerve injuries very frequently in your clinical practice. So you must be able to effectively manage them with medicines. First in the list we have Arnica montana. So here we will not discuss in detail about the medicines. We will just see the sphere, we will just see the indication and a keynote of this medicine so that quickly we can differentiate or compare them from one another. So here if you see the sphere, arnica is used for any trauma, especially blunt trauma, for bruises and for shock. So one more important thing that I would like to say here is please do not prescribe arnica in case of surgical cut. Indications: falls, blow, contusions or post-surgical soreness but not cut or bleeding. There you shouldn't use arnica. Coming to a keynote symptom, as if beaten, aversion to touch. Okay, so as if beaten or aversion to touch. Next is calendula officinalis, which is prepared from marigold. Sphere of action, it mainly acts on the soft tissue, it helps in healing and it also acts on the skin. Okay, it is indicated for laceration, it is indicated for surgical cuts, for ulcers and definitely for bleeding. So that is how we use traditionally marigold. Okay, keynote prevents granulation, promotes granulation rather and prevents infection. So basically it's nothing, it acts like an antiseptic, right? So calendula basically acts as an antiseptic. Next what we have is ruta gravulans. Ruta, the sphere, is mainly concerned with the periosteum, tendons and ligaments. So ruta is a very good medicine for your sprains or strains or even bruised bones. Okay, there is stiffness after overuse. There is too much stiffness in ruta. Okay, stiffness after overexertion or after overuse. Okay, backache is also a very important symptom here. Okay. Next, symphytum. Coming to symphytum, the main sphere is bone or fracture. It lessens the peculiar kind of pain which is seen in fracture. So there is non-union of bones, there is blows to the eyes, and coming to the keynote, it accelerates callus formation or the bone setup. Okay, next what we have is hypericum. Next what we have is hypericum. Mainly it acts where nerve is too much. I mean the concentration of nerve or the sphere of action is the nerve. Okay, hypericum is indicated for punctured wounds, for crushed fingers and toes, even for your spinal injuries. The keynote is intense nerve pain, or even if after your tooth extraction also hypericum can be indicated, because ultimately it's one and the same thing. When tooth is extracted out, the nerves are injured. So there also we can apply hypericum. Okay, mainly when the nerves are injured, we can think of hypericum. Next is ledum. Ledum is indicated for punctured wounds, bites and stings. Indications are sharp objects, injuries, insect bites. Keynote, coldness of the affected part and better from the cold. Okay, this is a thing. Next we have is rustox. Again, rustox acts on the ligaments and the joints. Rustox acts on the ligaments and the joints. The basic indications are sprain, stains, stiffness after rest. Now, the modalities are very important in case of rustox. It is better from motion and worse from rest and damp cold weather. Okay, which is just the opposite of bryonia. In case of bryonia, the patient is feeling aggravated by motion and better from rest, which is entirely opposite seen in rustox. The next what we have is silesia. You see, silesia, the sphere, it's for chronic wounds and suppuration. For abscess formation, suppuration, we have silesia. The indication is that non-healing wounds, and also it helps to expel foreign bodies. Suppose if a thorn is prick inside the skin and from there is suppuration, there is too much pain and all. So what silesia will do is that it will expel that foreign body, the thorn or something else which is inserted in your skin, inserted in your body. So that is the beauty of silesia, that it has the ability to expel the foreign body. Coming to the keynote, delicate constitution and slow recovery. Basically, this is a constitutional remedy. As we see in constitutional remedy, we do a totality of symptoms considering everything, mental symptoms, physical generalities, as well as the particular symptoms. Then we prescribe or go for that medicine. So silesia should be treated in that way and should not be considered as a specific remedy for injury, because this is a polycrest drug. Okay, thank you. If you do like the video, please like, share and subscribe. Thank you.